Welcome back to my channel. Today I will be break down the basics of ECG or electrocardiogram. What it is, why it is done, and how to read a simple ECG. If you are a nursing or a medical student, then this video is for you. So let's start. ECG was discovered by William Einthoven in 1895 and it acts on the principle of galvanometer. There are three terms which may confuse you: electrocardiograph, electrocardiography and electrocardiogram. Electrocardiograph is the instrument or the machine. Electrocardiography is the whole procedure and electrocardiogram is the graphical representation of electrical activity of the heart over a paper. So an ECG is a test which records the electrical activity of the heart. Each heartbeat triggered by an electrical impulse. An ECG helps you see the impulses as waveform. ECG is a non-invasive, quick and painless method. It helps to detect arrhythmia, heart attack and electrolyte imbalances. Let's look at the component of a normal ECG wave. An ECG wave have a P wave, QRS complex and T wave. P wave denotes the atrial depolarization. QRS complex denotes the ventricular depolarization and T wave denotes the ventricular repolarization. Although it is called a 12-lead ECG, we actually use 10-lead ECG to get 12 different views of the heart. So there are 10 electrodes or 10 leads. Among them, 4 are ring electrode and other 6 are chest electrode. 4 electrodes placed in 4 different positions of the body. Red electrode will be placed in the right arm. Yellow electrode placed in the left arm. Black electrode will be placed in the right leg. Black electrode is neutral or grounded. And green electrode will be placed in the left leg. Then come to the chest electrode. Chest electrodes are 6 types: V1, V2, V3, V4, V5 and V6. V1 lead will be placed in left side of the 4th intercostal space. V2 lead will be placed in the right side of the 4th intercostal space. Then V4 lead will be placed in the 5th intercostal space and then V3 will be placed between V2 and V4 lead. V5 lead will be placed in the left anterior axillary line. And the last V6 lead will be placed in the mid axillary line. Let's look at some critical abnormalities we should recognize instantly. First is ST elevation, which indicate acute myocardial infarction. ST depression, which indicate ischemia. Then if there is presence of irregular rhythm and unclear P wave, then it indicates atrial fibrillation. White QRS complex indicate ventricular tachycardia. The heart rate less than 60 beats per minute, then it indicates bradycardia, and if the heart rate is more than 100 beats per minute, then it indicates tachycardia. So ECG is more than just a machine reading. It helps in ICU monitoring, pre-operative assessment, hospital monitoring, also diagnosing electrolyte imbalances like hypokalemia, hyperkalemia, etc. So that's all for today. Thank you all for watching. If you like this breakdown, please like, subscribe and share. Comment below if you want me to cover ECG cases, practice question and abnormal ECG reading in detail. Thank you all for watching.